Welcome back. You are watching the Frontrow with me, Akisa Wandera. Thank you for staying with us. We're answering all your questions regarding the COVID-19 vaccines as Kenya continues to ramp up the vaccination exercise across the country. With me here in studio, I have Dr. Mulwa and Dr. Aya just trying to respond to a lot of your concerns on the vaccine. And before we went on a break, I'd mentioned one of the biggest concerns is around COVID and fertility. Dr. Aya, do you want to take that? Does it cause infertility?
No, it does not. Yeah, so there really isn't a way in which the vaccine would interfere with the reproductive system. So the answer is just no, it doesn't.
So then, looking at the concerns of many, and we've now given the expectant women a go-ahead to take the vaccines. So then there's another rumor that I've seen myself on social media, that women who take the vaccine or have had COVID when they were expectant give birth to children with low immunity.
It's actually the other way around. So start from the beginning. COVID requires, in order to prevent COVID without the vaccine, requires you to social distance. So your fertility is not an issue because you shouldn't even be close to anyone in the first place. You should be physically distant. So you require vaccination in order for you to come close to anybody to even know whether you're fertile or not. So that's one thing why people should take the vaccine. Secondly, if somebody is already pregnant, you know, just part of normal without COVID, 10 to 20% of women miscarriage. So that's the risk that's there already. Now, the COVID makes it worse for pregnant women in terms of increasing the risk of miscarriage and also increasing the risk that they end up in ICU with COVID because the immune system goes down in pregnancy. So really women should be encouraged to, both those who are pregnant and those who are not pregnant, should be encouraged to take the vaccine. Secondly, studies have now shown that some of the vaccine may get through the breast milk to the baby and offer some protective value to the baby as well. So there is an advantage.
Okay. Dr. Mulwa, I know that our phone lines are open and we have a number on the line, but let's hear Steve Sang from Nandi says, I got the jab yesterday and I have felt really sick, chills and headache. What should I do? So talk to us about the side effects and how we manage them.
I think most of the side effects that we have recorded in this country, because we are doing surveillance for adverse effects following immunization, have been mild. So you get a mild headache, you'll get mild joint pains, mild body ache, general fatigue. Some will report nausea, but all these have been mild as far as we are concerned. We have not reported a single death following immunization. We have not reported any severe adverse effects following immunization. We are keeping track of this, and I would tell him that if you experience that, to me, it means one thing, that the inoculation is working, and therefore something has gotten into you and is having an effect on your body, which is now creating the protection that we require against COVID-19.
Quickly, have we reported any blood clots, perhaps?
We have not reported a single case of blood clots in this country. Cases of blood clots have been reported elsewhere, but not in this country. Okay,
great. Let's hear those who are on our lines. Let's get our first question, and perhaps we advise that you keep it so short so that short and concise, so that we can get as many questions as we can for our experts in studio. Kevin Kipkorir from Nakuru is on the line now. Kevin, good evening. How are you?
Good evening, madam.
Yes, your questions to our experts regarding the vaccine?
I would like to ask, hello?
Yes, go on.
If there is an effect on using this drug, since some of the current religious Kanisa churches are spreading the rumor that it is targeting youth so that they due to high population, so the vaccine is targeting at reducing the birth rate in the future. So they are claiming that this vaccine is being used so that the future will reduce the rate of children being born. Another thing is there is a rumor that this vaccine is targeting the old people, so that they might die wanaweza kufa in the next future to give room for the newborns.
Great. Okay, great. Kevin has asked 2 questions, and there's another question here, just the same from Evans, on whether we are trying to control the population and whether it's targeting older people. So we'll be taking that. I think we have another caller on the line, just so we take a number and they respond to them. So Mercy from Nairobi is on the line. Mercy, good evening.
Good evening, Akisa. My mom is 58 years old, and she's struggling with whether to go and get the jab. Hello?
Yes, Mercy, let's just take it from the top. We've missed something.
Mom is 58. She really wanted to go and get the vaccine, but she really feels cold very early in the morning and late in the evening. So people tell her that now, since she feels like she has a cold, she's not advised the jab. So what is the way forward? What should she do?
As a 58-year-old mother gets very cold, perhaps an allergy to cold, and people are telling her she'll get worse when she gets the vaccine. You'll be giving us a response to that. Nelson from Nandi is also on the line. Nelson, good evening.
So what is the way forward? What should she do? As a 58-year-old mother gets very cold, perhaps an allergy to cold.
Use the volume of your TV so that we're able to get you clearly. Nelson?
I'm Enoch.
The volume of your TV so that we are able to get you clearly.
Yeah. Hello?
Go ahead.
I'm Enoch Onyanja from Nyamira.
Yes. Yes, Enoch. Thank you very much.
I'm sick of sickle cell anemia.
Uh-huh.
And I'm 61 years old. Can I be vaccinated or there is a side effect?
Okay, sickle cell anemia, our experts will be responding to that. We have another caller, we take that round. Okay, that's it. A lot of questions. I think we should start from the top, where he was asking about controlling the population.
I think I would, everyone last year, across the globe, the lockdowns, the restriction of movements, the deaths that were massive deaths that were reported in many parts of the world. If there was anyone with the intent to control population, why not let the disease continue killing people? It was already killing people anyway.
Yeah.
So it can't be further from the truth. This is another myth, misinformation, no scientific basis, and anti-vaccination, just a message from the anti-vaccination campaign, which is aimed at creating hesitancy in the population so that they don't get. But if really anyone wanted to control the population, why not let the disease?
There'll be better ways to do it.
Why not let the disease? Why not let the disease continue killing people? It is killing millions.
Anyway.
It has killed millions anyway.
Right.
So why not let it? So I think that cannot be. Nothing can be further from the truth. It is this vaccine. It's to the contrary. Its aim is to, one, regain humanity as we know it, where business, economic development, people can participate in all activities, can socialize. It is love not to visit your parents today. We want to go back to where you can go, visit your parents, and socialize with them, socialize with your friends. That's where we want the world to go back to, and not to control population.
Okay, great. Dr. I think I want you to take for Mercy, who said the mother is 58, feels cold in the morning and in the evening, and she's being told that if she takes the vaccine, it would get worse. And I'm hoping my mother is watching the show today. And also then, with that, things like asthma, should they get vaccinated?
So the general rule is yes, they should. So the question then would be if this is something that has just happened or this is how she generally feels. So if anybody has any doubts as to whether they should take the vaccine specifically, because we don't have all their medical condition, then they should see a medical practitioner before they get the jab. So if anybody has any doubt, they should be checked first. But in general, there isn't an exception, because anybody with any kind of underlying condition is vulnerable to COVID, the disease, and therefore they should take the the vaccine.
Onyancha from Namira also talked about sickle cell here.
Yes, they should.
Yeah.
They should.
The comorbidities what we're talking about.
Those are the reasons
why they should be the priority for immunization.
Yes.
Precisely. So you have any underlying condition, you become a priority target for immunization. Because when you get COVID, you are worse off than that other person who does not have another comorbidity disease.
Okay. So there's another question, interesting. Can one take alcohol after vaccination, and does it have any effect? So then, do's and don'ts when you're getting vaccinated.
After how long?
Okay, didn't specify.
Why do you want to go to the hospital and immediately rush to a bath or a drink? I mean, surely. The general thing is don't mix. I mean, you're going to have those effects, those mild side effects that we're talking about, that headache and feeling tired and so on. So my advice would be that you give it a break of at least 24 to 48 hours. Yeah, if you can last that long, please do, so that we know that the way you're feeling, it's because of the vaccine. The vaccine
not the alcohol.
And not the alcohol. Yeah.
Dr. Mulwa, Dan from Dunduri asks, is AstraZeneca vaccine lowering libido in men? Someone in studio.
Actually, contrary. There is a study published last week to the contrary.
What are you going to...
You will make everyone go get vaccinated.
But this is purely not on the libido, but on the sperm count. That actually a small study of about 50 people, and showed that 8 of the subjects had a low sperm count before vaccination, and all of them after vaccination. Was it 12 weeks after vaccination? To the contrary, it has a positive effect. But be as it may, it is not reducing libido.
Okay. I'll take another question here. Ogeka Areka says, please ask the doctors whether Africa and Kenya in particular has a capability of testing the worthiness of donated COVID-19 vaccine to secure state sovereignty and national security.
No, we don't, and we don't have to. Yeah. We don't have to, because these things the vaccines have been approved by WHO, and there are fairly stringent measures in place as the vaccine goes through the whole process of being received and so on, and there's continual testing, and we have a pharmacy and poisons board that does the monitoring thereafter in conjunction with the manufacturer as well. So vaccines are in a category of drugs, I would say, very, very high in terms of the monitoring both before and after. Yes.
And still on that note, there's a question on, can somebody take the vaccine if they have food allergies? Talk to us about other allergies, perhaps.
Most of the vaccines that we're receiving do not have the common food allergies. This is something that came from the old vaccines that used to be used. So, for example, people used to talk about egg-based and so on. None of these have that. So there isn't any much in terms of food allergy or anything like sulfur and so on, which is what the egg thing is about. So the answer is it's safe for use, even those who have the common food allergies.
Okay. Hello, I contracted mild form of COVID 2 months ago and later got cured. And since my immune system developed the antibodies to fight COVID, I'm better like someone who has taken the 2 vaccines. Should I take the jab? I think we answered that.
I think for safety, anyone who does not have active COVID-19 infection should take the vaccine, because studies have shown immunity that is developed after exposure to COVID-19 wanes after 8 to 12 weeks, and by the time it's 6 months, you almost have zero immunity as a result of the infection. So because the vaccines have been tried and tested, and immunity is lasting up to 9 months for what we know, plus, then I think it's better to take the vaccine than to stay without. And because, one, there are many variants of the COVID, and the vaccines have been shown to be protective against several variants of the disease.
Okay. So then, Mohammed Abe says, can someone with diabetes and high blood pressure take the vaccine, and are there any medical implications?
They are the #1 priority.
Priority list.
They are the number one. Diabetes, hypertension is the number one priority in terms of the people who we target to get the vaccines. And anyone who has diabetes, hypertension, or any other chronic illness should take the vaccine because they have poor outcomes, for what we know, when they get the infection.
Okay. Miresha Wit is asking, how about lactating mothers? Can they get vaccinated? I think we've answered that. The answer is yes, Miresha. Lactating mothers can get vaccinated. Should get vaccinated.
Yes.
Thank you for that. Good evening, Frontrow. When filling a COVID registry online, why is it that it forces one to choose a medical condition that one has? Example, asthma. Think better tracking?
Yes. Essentially, yeah. Essentially that.
Okay. So let's get callers. I'm told we have 2 callers. Let's see what they have to say. Charles from Maragua. Charles, good evening. How are you?
I'm good.
Great. What's your question to our experts today?
Yeah. Well, yes, the job is done day by day. Yeah. The job is done day by day. The job is done day by day.
Yes.
How are you determining whether one is having a COVID-19 and yet testing isn't being done at the center? And again, how know? Because it will take time for somebody to know whether he is positive, COVID-19 positive or negative, because it is not done with an abrupt or immediate effect.
Charles, could you please just repeat your question? I don't think we got... Yeah, you got the question? Okay, great. Charles, you got the question. I think we have another Samuel from Nyahururu. Samuel, good evening.
Sometimes last year, I think it's this year. Hello?
Yes, go on, Samuel.
Yeah, I'm asking, sometimes this year, PS Susan Mochache was on one of the TV stations, and she was actually speaking about those who are allergic to eggs and chicken. And she said that those people are not going to get the vaccine. But yet again, I'm hearing Dr. If they're saying that we shall still get the vaccination. The correct status of the same.
Great, thank you. Do we have another caller on the line? Or we can take the 2, then we'll get more calls.
I think I could start with the issue of allergies to eggs and other food allergens. In the beginning, because like Dr. Ari already mentions that the vaccines, the traditional vaccines, have been were traditionally made with food-based food basis, and therefore allergies to eggs and were a possibility. And because these were new vaccines, and as they were being introduced, there was need for caution. Further studies have shown that, one, there is no absolute contraindication to the vaccines when one has allergies to any food. And therefore, one, at the time when the PS was indicating, which is when we were introducing the vaccines, the scientific body of knowledge was not sufficient to guarantee that if you get vaccinated and you have an egg problem, you may not get adverse reaction. But now we have enough evidence that you are likely to get adverse effects as a result of the vaccine. And therefore, that is enough now, because scientific information keeps changing, because research is ongoing on a day-to-day basis. And from administration of the vaccines, we learn more and we update ourselves more. Just in the same way, 3-4 weeks ago, expectant mothers and lactating mothers were not supposed to take the jab. Now they are. And we are telling them, you should take the vaccine. So it's continuous updating of the scientific knowledge that is coming through.
Before we go to the other caller, there was a question from Charles from Maragua.
I think what he was asking was, why aren't we testing people before giving them the vaccine? That I may have the disease, and then you're giving me the vaccine at the same time. So the answer to that is that, first of all, 90% of people with COVID have 0 symptoms. So, you know, we would not know anyway. The cost of the vaccine vis-a-vis the cost of the test, you know that the test costs from about 4,000 shillings to about 10,000 shillings. So the test costs more than the vaccine. And therefore, there's no money in the world that we would have to test everybody first
then
vaccinate. So really, it depends on only those who, if you have any kind of symptoms, then you would wait. But the effective way to do it is to just vaccinate. So the advice given is that if you feel sick, don't take the vaccine on that day. Wait until you feel well. So it's up to you to say, I am well, then I can take the vaccine. Yes.
I think there's another caller before we go on a break. All right. Let's take a quick break, then we'll come back with another round of questions. There's already a question here on that they hear that those who've been vaccinated will need to be vaccinated again after 8 months. So this are some of the questions we'll be responding to when we get back. Keep them coming, 22155. Our phone lines are also open. The numbers are on your screen. Do ask as many questions as we can. Experts are here to respond to your questions. Get you as comfortable as possible to be able to go and get a job and also encourage those around you to do the same. This is a front row. Let's take a quick break. We'll be back with more.
This is KTN News.
To answer, Mary.
Mary has a toothache.
Oh, I see. And who knows why?
Because the tooth is too big.
No, it might be a hole in her tooth called a cavity. That's why I brush twice a day using Colgate.
Imagine this is your tooth and these are food acids that cause cavities. Colgate with calcium and fluoride helps prevent cavities.
Who protects our teeth? For maximum cavity protection.
Introducing Colgate's Double Action Charcoal Toothbrush with charcoal-infused bristles.
The night gets cold and the chill takes hold. Cozy up
with Choco Primo drinking chocolate from True Foods.
Rich, full drinking chocolate. Stir a spoonful in a cup of hot milk. Enjoy the goodness.
Cozy up with a Choco Primo cup.
Choco Primo drinking chocolate from True Foods.
No matter what your better is, realize, secure, empower it with Zamara's pensions, medical and insurance solutions. Life is better with Zamara.
Not only the colors, it's the meaning behind the numbers. On the Trading Bell Show, we not only give meaning to the numbers, but we also engage industry leaders behind these numbers.
We think there's a good case to be made for more listings.
Every Wednesday, 8 p.m. on KTN News.
right, you're watching the Front Row. Thank you for staying with us, even as we have the conversation around vaccines and vaccinating Kenya as the government tries to get as many Kenyans as possible vaccinated. The government is talking about vaccinating 10 million people by December this year and about 30 million in June next year. And we have experts in studio to just help us try and understand not just the processes, but also respond to some of your concerns with regards to this particular vaccine. And we'll continue taking the last round of questions before we finish the show. Someone asked here, can someone donate blood if they have been vaccinated?
Why not? I don't think, not I don't think, vaccination is not a contraindication to blood donation because blood first after donation is screened and is screened whether it has various diseases that if it has is destroyed. If it's clean to be transferred to the next person, it is. And antibodies against COVID-19 are not amongst what is looked for in terms of the diseases that could potentially make blood inappropriate for transfusion to another person.
We've all been vaccinated against all these other diseases, and we all donate blood.
So, okay, Mr. Ndichu from Kiambu says, I'm HIV positive and on ARVs. My viral load is undetected results. Is it safe for me to go for the COVID-19 jab?
Take it.
Yesterday.
Like yesterday. Yes. This is the group we're targeting.
Yes.
And Charles Ndirangu says, I suffer from blood clots. Can I take the vaccine?
Consult your doctor.
Okay, Charles, you'll have to consult your doctor before you take the vaccine. Let's see. Why is vaccine forced on people while others not? Medication forced while others faiths, we don't believe them and we are okay. So then the religious aspect of it all.
I don't think there is any forcing.
I think it's talking about civil servants who've been given a deadline.
What we're asking and what civil servants have been asked is, you are frontline workers. You have been given 6 months as priority group. You are not showing up for vaccination. You are not reporting to your duty stations. Kenyans want your services. You are working from home while Kenyans want your services. To enable the government have its workers back to work, then frontline workers, it's just like if nurses, doctors decided that they are not going to get vaccinated, and because they are going to get exposed to COVID-19, they stay at home. Citizens would suffer. So this is a rational public service management decision that come get your vaccine so that you are able to deliver the services to the public that you are supposed to do. So it's just an administrative decision. So it's not being forced, but it's the right thing to do.
Okay. Dr. there have been cases of small, light, metallic objects being sticking in on vaccinated area of the hand. Why is this so? That's Nixon Dugire from Kindaruma. I don't know.
Have you had any of such cases? No, I haven't come across.
I think we've seen that in social media, which I think is
but anything reported on that?
There is no scientific evidence that is related to vaccines, and no one can say whether it's a vaccine or it's just anti-vaccine. We have seen all sorts of things in social media, and most of them are baseless.
And the jab is on the right arm, upper arm.
Yes.
Yes.
So then there's a question of, once I'm fully vaccinated, do I need to still wear a mask? And we've seen some European countries say that you can now stop wearing masks. What's the rationale and where do we go from here?
I'll start. Why we continue wearing masks even when we are fully vaccinated is to protect those who are not. In populations where immunization of vaccination is close to 100%, you may fail to wear your mask, and we have seen it in Europe because why? Because the population is almost fully vaccinated, and therefore, if I get the disease, the next person, and I transmit to the next person, they are protected against the disease. And therefore, it's important for us, because our vaccination is still 2.9%, we need to wear the mask until such a time that a significant population, 70% of the population, target population has been vaccinated, so that you don't transmit to the next person. That is the basis. That's why we continue wearing masks, even those who are vaccinated. And the risk is, even when you stay with people who are not vaccinated and you transmit, you are likely to meet someone else who is not, and you transmit. So we continue to ask people to wear, to protect the others. Yes.
One is asked, how about left-handed people? Which side of the hand should they be vaccinated?
The inactive hand.
The inactive hand.
The non-dominant.
Okay, great. Because I think they ask you first, which hand do you write with?
Yes.
Yeah.
So there was a question before on a break that whether those who have been vaccinated will have to do it all again by 8 months. And I'll pick it together with what Mutuku from Kitui is saying. Is a vaccine a one-time activity, or will it be repeated later?
So the basic answer to that is that we don't know. It's evolving right now. What has happened is that in the US, they've recommended a booster shot for those who are most vulnerable. So they're looking at, because they're monitoring the immune response over time, and it seems to be decreasing for some people who already had very low immune status to begin with. So in our population, that, the people with there are very few people with a very low immune system. So we don't know yet.
It will take time?
It will take time for us to, to see,
Dr. Mulwa, how sure are we that people will get the second dose on time? And thirdly, if one gets the jab and gets sick or dies from it, where are we supposed to report, or who will be responsible for that?
First, we have a global mechanism working through the COVAX, the Africa CDC mechanism to ensure that there is flow of vaccines. We, of course, have a global challenge because while the rest of the world are vaccinating 60, 70, 80% of the population, the African continent has not reached 5%. We are targeted by September this year that all countries would have done 10%, then 20% by December, then 100% by... Some countries have achieved 100%, while here in Kenya we are at 2.9%. We are even seeing inequalities, even within the country, where there are some counties that have done under 1%, and there are counties like Nairobi that are already 8.4%. So these disparities exist, and what we are saying is we have a challenge with supply of vaccines, global challenge. But because we have now the WHO COVAX mechanism, we have the Africa CDC mechanism, which guarantees that there will be flow of these vaccines to the African countries. There has been an issue of vaccine nationalization, where the richer countries are buying all the vaccines and leaving nothing for the poor countries. So these are issues, but for all purposes and intents, as a government, as a Ministry of Health, we have put in mechanism to ensure that we have consistent flow of vaccines. And therefore, a second dose should not be a worry to anyone.
Let's get the last round of callers and get the last round of questions. We only have about less than 10 minutes to finish the show. We have Richard from Kericho on the line. Richard, good evening. Thank you for watching the Front Row.
Yeah, good evening to you. How are you, Alexa?
I'm great. I hope you're well too. What's your question tonight?
Yeah, my question is, how safe is the vaccine for somebody with just the problem as far as asthmatic issues are concerned, and blood pressure, and other chronic allergies? Is the vaccine safe for them?
Okay, great. We'll be responding to that, and I think the answer will be yes, but the experts will speak to it as well. Let's get to the next caller, Raphael from Kawangware. Raphael, good evening.
Good evening. I have two questions, quick ones. One, what are the contents of the vaccine? Good evening. I can hear you.
Yes, please reduce the volume of your TV so that you don't hear yourself. Yeah,
it's down. Now, two questions.
The first question. What's the second one?
The second one is, what will happen to those populations that will not be vaccinated at the end of the vaccine?
Okay, thank you very much. So first question from Richard from Kericho, underlying conditions once again, asthma, chronic allergies. And I think you'd already alluded to that yes, they are safe they're the priority list. Then he's also asking, Raphael from Kawangware is asking, what are the contents of the vaccine?
So essentially, the contents of the vaccine is that it's going to have a piece of the virus, okay, a manufactured piece, and that's what your body reacts to form the immune response. And then the rest of it is basically packaging, some liquid to be able to carry it into your body and to keep it stable. Essentially, that's what it is.
Here's a second question. I think I've missed it, but let's see what else we have here. What happens if the first dose time limit to the second one lapsed by far? What should one do? So perhaps you were given 6 weeks, but it's past that.
I think because in this country we have only given AstraZeneca, and studies have shown vaccination between actually 4 and 8 and 12 weeks. And the longer you stay, the better. But for purposes of standardization, we chose 8 in the first place. Then because of the supply chain issues, we got 12, which is actually the peak that the immune response is better when you get your second dose at 12 weeks. So I don't think, unless it is significant, like you've missed for 3 months, then I don't think, and that would be now subject for new research.
New research.
Yeah.
And you still have protection even with the first at about 60%. Yeah. So what it would be is that even if you took many months, you'd still come back, you'd have something over and above that 60%. Right.
Yeah. Mercy from Nyeri is asking, can someone get vaccinated while undergoing dialysis awaiting transplant?
I think that's one of those very specific cases where you should consult your doctor. Yeah.
I got the first dose when I was 1 week pregnant. How safe is the unborn child? I think we've responded to that.
We said that studies have shown that the vaccine is safe in pregnancy. Yeah.
A concern here from someone who says, kindly ask the doctors to clarify the issue of allergies. I went to JKIA to receive my jab, but nurses there said I should see a doctor before I get the jab. I have red meat and milk allergy. Please set the record clear. That's Busolo Agri on Twitter.
I think the nurses are right, that they need to first get an approval from a practitioner that give. Because if someone feels uncomfortable to administer the jab, you see your practitioner, so that we know if you get the vaccine, you are already under care of a professional who, in case you get adverse reactions after immunization, you are able to get care as a result. We have, however, to this time, not gotten any adverse effect related to allergies so far in this country. Yes.
I think I'll take the last round of questions because we don't have too much time left. James from Tarakaniti says, what's the immediate care after the injection? What about fevers, headache, and general malaise after injection? What do you need to do?
You need to rest. Yeah, I think the day after, especially when you're feeling a little sore on your arm, you need to rest. And if you feel that malaise is a little bit heavy, then you take some paracetamol, and really it should resolve by the following day after that. Yeah, a few people it lasts maybe another day or so, but the key thing is to rest and take some paracetamol.
Okay. There's a question here from Joy from Maweli, and I think we alluded to it at the beginning. Why is it that teachers are being vaccinated while pupils are not?
We said, one, the research that has been done on adult population, we already have enough data, and that's why the vaccine was introduced for adult population. Pediatric research, I think, has been done in China and Europe, is still ongoing. Maybe in the next few months, we will have a global picture on how to do child immunization, vaccination. The beauty about it is the children get the disease. When they get the COVID disease, they don't get a severe form of disease, and most of them are asymptomatic. Teachers, on the other hand, who are adults, may develop symptoms that may lead them to getting severe disease, and therefore it's important for them to be protected, because the children may have the disease and not show symptoms. The children can transmit to the teachers, and the teachers get severe disease.
Yeah, okay.
So that's the rationale.
Once again, back to protecting
the vulnerable.
Okay, the vulnerable groups. Hi, Akisa, can someone who has just been vaccinated transmit the disease, Dr. Aya?
That is from the vaccine.
Yes.
Remember that the vaccine is not the disease.
Unless he's asking you, you have COVID, you haven't
that you had
recovered,
COVID already.
vaccinated.
Yes. So if you had COVID and you're in that 14-day period, of course you still have the disease. But the vaccine, what you're given is not the disease, and therefore there's nothing to transmit at that particular point. Yeah.
What is herd immunity? If this is attained in the danger of COVID-19, if this is attained, is there danger of COVID-19 to the unvaccinated?
Herd immunity is if I pass the virus to you, and you pass to the next person, and to the next person, all of them are vaccinated. So the risk of the virus just dies naturally, because it cannot get someone who it will affect. But that is herd immunity. That's protection in numbers. So many people, enough people have been vaccinated so that when the disease is spread from one person to another, it dies off, because it cannot have infectivity on those people. But for those unvaccinated, the 10, 20, 30% that are unvaccinated are still at risk, because when I'm vaccinated, I may be able to transmit the disease to you who is not vaccinated. So the risk still remains. So it's important, where 100% coverage can be attained, it is what we need to look forward to.
All right, and we wrap it up on that note.
And Prof, I'm sure Dr. Aya would add something on that.
Yes.
No, I think once herd immunity is achieved, then it means that the people who have been vaccinated now protect everyone else. Yeah.
Okay, great. We end it at that point. I think we've been able to respond to a lot of those questions. So I think we should have another session like this to just try and answer as many questions as we can from the Kenyans. Thank you very much for joining us here in studio today. Dr. Andrew Mulwa is the Acting Director of Medical Services at the Directorate of Preventive and Promotive Health. And Dr. Aya is a member of the National COVID-19 Vaccine Deployment and Vaccination Task Force. Once again, thank you for joining us here. And the viewer who's been texting, asking questions, calling, thank you for always joining us here on the show. I am Akisa Wandera. I'll be seeing you next time here on the Front Row. Thank you for joining us.
Thank you.